Mr. President, I rise today in recognition of National Eating Disorders Awareness Week and to bring attention to the millions of Americans struggling with eating disorders. Eating disorders, not something we always talk about on this floor, but in fact, eating disorders are more common in our country than breast cancer or Alzheimer's and do not discriminate by class, race, gender, or ethnicity. The all-too-sad truth is that eating disorders take the lives of 23 Americans every day. That is nearly one life every hour. One life every hour. Our understanding of how eating disorders develop and progress is constantly evolving. We know that there are between, and again, because we don't have good statistics, except for when people die, between 15 and 30 million people across the country struggling with an eating disorder. We know that anorexia has the highest mortality rate of any mental health disorder. Listen to that. Any mental health disorder that you can think of, anorexia has the highest mortality rate. And we know that eating disorders affect women 2.5 times more than men, making this the important women's mental health issue. Unfortunately, far too few of these people are getting the help they need. Only 1 in 10 people with an eating disorder will receive treatment for that disease. And for those who don't receive any treatment, the rate of recovery sharply declines while the likelihood that they will be hospitalized rises. The numbers illustrate a grim reality. Too many Americans are suffering in silence, unable to access the treatment they need to conquer their eating disorder and to go on to live healthy lives. To help the millions of people suffering from eating disorders get the treatment they need, I have introduced the Anna Westin Act with Senators Ayotte, Senator Capito, and Senator Baldwin. We are very proud that this is a bipartisan bill that is supported by both Democrats and Republicans. The fact that it is led by all women senators, maybe our time has come, given that, again, women are 2.5 times more likely than men to suffer from this disorder. We remember in the early days when it was the women senators who united to do something about breast cancer research, or when it was the women senators who said, why are we just studying men when it comes to various drugs and various diseases and cancer? Women have different interactions. Women have different problems. And in fact, these eating disorders affect women 2.5 times more than men, yet not literally hardly anything is going on with this in terms of help and funding. The #1 mental health disorder that leads to death, highest mortality rate, is anorexia. The bill is named in honor of Anna Westin of Cheska, Minnesota, who was diagnosed with anorexia when she was 16 years old. Her health started deteriorating quickly after she completed her sophomore year at the University of Oregon. She began suffering from liver malfunction and dangerously low body temperatures and blood pressure. Even though her condition was urgent, Anna was told she had to wait until the insurance company certified her treatment. This ultimately delayed and severely limited the treatment that she received. After struggling with the disease for 5 years, she committed suicide at the age of 21. My colleagues, we have a moral obligation to help people like Anna and families like the Westins, and we cannot afford to wait any longer. Last week marked 16 years since Anna's death, and yet people with eating disorders are still not guaranteed coverage for life-saving residential treatment by insurance companies. The bipartisan Anna Westin Act fixes this problem by clarifying that the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equality Act specifies that residential treatment for eating disorders must be covered. We're talking about when a doctor diagnoses an eating disorder and believes, after trying different treatments or believes that there's an immediate emergency situation, that there should be coverage for residential treatment, which has been found to be really helpful with eating disorders because it helps to change how someone is eating and what they're doing and how they're interacting and what they are going on with their day-to-day life. My friend, the late Senator from Minnesota, Paul Wellstone, fought hard for that Wellstone and Domenici mental health parity law. As Paul always insisted, a mental health parity bill is about equality and fairness. It is time that patients who are struggling with an eating disorder receive that equality and fairness. It is time that so many of these women who suffer from this disease that is much more particular to women than men get to receive that treatment that you get for other kind of mental health disorders. This bill would ensure that patients like Anna Westin aren't prevented from getting the treatment they need simply because their insurance doesn't cover it. Eating disorders become life-threatening when left untreated, making early detection absolutely critical. That's why this bill would also use existing funds to create grant programs to train school employees, primary care physicians, and mental health and public health professionals on how to identify eating disorders, as well as how to intervene when behaviors associated with an eating disorders have been identified. I think most young people today know someone that has an eating disorder. I remember in college a number of young women that had eating disorders, but they were hiding it. No one did anything about it. I have no idea how they're doing now. Making this investment is a no-brainer. By drawing on existing funds for the training programs, this bipartisan bill is designed to have no costs associated with it. These common sense and long overdue actions will help give those suffering from eating disorders the tools they need to overcome these diseases and prevent more tragedies like Anna's. We wish that Anna was still with us. We wish that she could have graduated from college, started a career, and had children of her own. While it may be too late for Anna, we know she would want us to do everything we can to create a world where eating disorders are acknowledged, are recognized, are treated, and are prevented. I am so proud. This bill has been out there for a few years, and this is the first time this last year where it has been a bipartisan bill led by 4 women senators, 2 Democrats, and 2 Republicans. The time has come. With affected families in every corner of our country, I invite all of my colleagues to join us in support of this bipartisan bill. We must act now to give the millions of Americans struggling with eating disorders the help they need. Doing so will not just prevent suffering, it will help save lives. Thank you, Mr. President. I yield the floor, and I note the absence of the quorum.
The clerk should call the roll.
Mr. Alexander.